6 weeks post-op face neck lift. All good, except I am really sad about my jawline and areas below the corner of my mouth. What can be done, if anything, to have under my chin more chiseled and the areas below the side of my mouth tightened like they were even 5 years ago? I spent $15K. Happy I look like me, but not the me of 10 years ago.
Thank you for your question. You stated in your question, and you've submitted several very good photos, that you're 6 weeks out from a facelift and you are concerned about your jawline and about the outer corners of your mouth. And you state also in the substance of your question how you still look like you, but not like the you that was from 10 years ago. Well, I can give you some guidance on how to handle this phase of your healing process and what options you may want to consider moving forward. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon, and I've been practicing for over 20 years, and I've written books on facial aging, and I've also written a good number of articles, as well as I've been a resource for media about procedures to enhance one's appearance related to facial aging changes. So certainly the challenge of trying to help someone look from the outside the way they look on the inside is something we deal with every day. And I begin every consultation with this educational process about the issues of what changes over a time frame like 10 years. You know, I always say that there's a big difference between 40 and 50 when compared to 20 and 30. And one of the big differences has to do with volume loss. Facial aging is a combination of volume loss and sagging and descent. So volume loss has to do with bone, muscle, fat, soft tissue. So that's meaningful. You know, the lines or the crispness of the jawline, if it's always subject to how much structure there is to lift up against. People who have weaker bone structure or have diminished volume, even when you pull and restore relationships and make things as, quote, as tight as is appropriate, you don't get that same look. And I think that's what you're dealing with in this situation. And the other part is, of course, descent, which you have dealt with. You dealt with it by having a face and neck lift. Now, I'd also mention that 6 weeks is still an early point in the healing process. If you learn about the phases of wound healing, there is what's called the hemostatic phase, where things are it's all about the bleeding and just the stabilization of that. There's the inflammatory phase, which is the first week or so, where we're removing a lot of the debris from the area after surgery. And then there's the proliferative phase, which is about a month. Beyond the month to 2 months where the proliferative phase occurs, then there's the remodeling phase. And that goes on for over a year. So understanding that, you realize you're still in a very relatively early stage of the healing process. It doesn't mean that what you are seeing is not going to be there or constant beyond this stage, but it's at least important to understand that there is still some healing that is going to happen. Now, as far as the desire to look like you did 10 years ago, you don't need to abandon hope. When I do my consultations with patients about this kind of situation, after I lift their face, I always point out how the marionette lines are still going to be somewhat present, how the indentation in the jaw, called the mandibular notch, will still be present because it's a bone loss. Now, what we have done is variations to help people come up with the best solution for them. And some people will combine a chin implant, a cheek implant at the time of facelifting surgery. With other people, we'll do a limited facelift and do something called the Y-lift, which I'll explain a little bit further, which is the use of injectable fillers such as Juvederm Ultra Plus at the deeper levels to almost mimic the placement of facial implants, but at the same time restore contour and volume that is missing. And then for other patients, we'll actually wait till after the facelift has healed, and then to enhance further the results, we'll do something like the Y-lift. You see, you can't always address everything with one surgery. Very often, especially when you spend a certain amount of money, as you described in your question, you feel like, well, I want to just do one thing and get it done with, and that's it. But since facial aging has multiple levels, you can't just do that. You have to kind of define success in very specific ways so that you don't face this type of frustration. So going back to the Y-lift, I would say that it's something that we do for a lot of people who aren't quite ready for a facelift or may want an alternative. The Y-lift is a very specific method of using a filler, a hyaluronic acid filler like Juvederm Ultra Plus, in a very specific way that is structural. It restores volume. So you may anticipate in your situation where for the jawline or for the cheekbones that once you've healed from the facelift, it's worth considering that as opposed to additional surgery. There are times when people think that if the surgeon just pulled a little bit tighter, that things would be better. But the reality is, and we know this from the history of surgery, facelifting surgery, particularly in the Upper East Side, where, and particularly in the 90s, I remember that a lot of people looked very pulled, and they didn't look young; they just looked mean. And so it's not about pulling; it's about balance. Nature, young person doesn't have a pulled look. So understanding that volume placed strategically will probably get you closer to that 10-year point that you want. And of course, skin quality improvements, such as the use of platelet-rich plasma and other modalities to improve skin quality and texture, will also probably help. You see, with facial aging, we can restore a lot, but there is still certain things that can't be fully restored, and the tissue quality and the volume that was there at a younger age can't be fully replaced, but certainly a lot can be done so that you look good at your age. And of course, I love the term that I use a lot, which is called the indeterminate age. Once you have balance and you have definition, people can't really tell how old you are, and it's not the most significant thing that's in the front of one's mind when they meet you. They just see you as a dynamic individual. So I don't think you need to abandon hope or lose hope. It's just get through this healing process and discuss this with your surgeon. I'm sure your surgeon has ideas about how to help you and will, of course, also guide you through this healing process. So I hope that was helpful. I wish you the best of luck, and thank you for your question.